Recording in progress.
Good morning and welcome everyone. Welcome to our members, our guests. We appreciate you spending some time with us today. My name is Katie Pryor. I am the Chief Development Officer and SVP of Member Engagement with the Greater Houston Partnership. Thank you for joining us for our second webinar over the past month, addressing the COVID Delta variant and its impacts on our community. Last month, we focused on our conversation on the current state of the public health environment. And today, in part 2 of our series, we'll look more closely at how the latest in this health crisis is being managed by our business community. As we noted last month, the partnership has a unique responsibility to our members, guests, and staff to bring timely and trusted information to you on this COVID crisis, and also to ensure that we are adhering to guidance from our medical experts. In light of the rise in cases over the past month, and because of the partnership's role as a convener, we made the difficult decision to temporarily pause our in-person activities for August. We look forward to bringing live events and gatherings back as soon as possible. We know that they are important to you as our members, and they're also important to us as an organization. And we've truly enjoyed being able to get back together over the summer months for in-person gatherings, and we will bring that back just as soon as we are able to safely and responsibly do so. So I thank you all again for your time, especially to our members for your continued support and engagement, whether it is in person or virtually. We very much appreciate and value you. Now I'd like to introduce Bob Harvey, Partnership's President and CEO, to lead off today's program and introduce our guest. Bob?
Well, thank you, Katie, and thank all of you for joining us this afternoon. As Katie said, I'm Bob Harvey. I'm President and CEO of the Partnership. And just following on Katie's comments, over the past few weeks, we've had a growing concern in the community about the Delta variant and its impact on the health of the community and our hospital system, frankly. We've gotten a lot of questions from business leaders around the topic. You know, this is posing a particular threat to Houston. The Delta strain is proven to be more significant than perhaps we even thought some weeks ago. And it's caused the business community to look very carefully at its return to work plans, looking at workplace protocols, looking at our vaccination policies, our protocols for in-person indoor gatherings. All of these issues are being reassessed in light of the current circumstance. We have a great panel today. I look forward to the discussion. And towards that end, we will take questions from the audience. If you have a question you'd like to submit to our panelists as we move through the agenda, please enter it through the Q&A, and we'll do our best to answer as many as we can. Some of them we'll just answer on the fly, but the panelists will attempt to answer them, and when they're not speaking. Others we will accumulate to the end. Momentarily, I will introduce the panelists joining us for today's discussion. But first, we'll take a look at some of the critical metrics from the Texas Medical Center that we've been tracking since the start of the pandemic. So why don't we go there first? First of all, as you can see, the number of cases, positive COVID-19 cases, has jumped up very appreciably over the last 6 weeks or so, and has now reached a level not previously seen throughout the pandemic. This is the daily average produced on a weekly basis through this past Sunday. And as you can see, we set a very high peak on the 7-day average through Sunday. I would say it's come down a little bit since then. We were cautiously optimistic a week and a half ago that we were seeing a peak, and then we had the big uptick. And now we're cautiously optimistic again. But in light of school reopening, we have a lot of concern that we really can't easily judge the situation locally until we get a few more weeks into the school year. So a lot of concern about the positive cases that we're seeing. Let's go to the next slide. Of course, we're also seeing a lot of cases presenting at our hospitals, COVID patients. So this is the daily average expressed week by week of new COVID patients presenting at our hospitals. And again, you see that we've hit a new peak, slightly above the previous week. And for the first several days of this week, we've seen the new hospitalizations continue to go up very modestly. So again, we may be seeing a peak in new hospitalizations, not certain at all at this point. And again, if the school situation evolves in an unfavorable direction, that could reverse all of this. Looking at the next slide, this gets down to looking at the total number of COVID patients in our hospitals day by day now. So this is day-to-day chart there at the top over the last 30 days. And what you see is the number of COVID patients in our hospitals has just continued to creep up, as you might expect, given the number of admissions on the previous slide. And again, if you look at the lower portion of the slide, you see how the current, what we call the fourth wave, compares with the previous two. The first wave was much more modest. And so we're seeing a total number of COVID patients in our hospitals, in our TMC hospitals, which is about 70% of our total regional capacity, reaching a level we haven't previously seen. The rate of increase is about 1% per day. Frankly, it was much, much higher than that. At one point a few weeks ago, we were up in the 7 to 8% per day increase. So again, we may be seeing some leveling off. We expect to see the cases level off. Maybe a week later, the new hospitalizations level off, and then a week or two later, the total hospitalizations leveling off. I would say it's not a chart, but one person confronted me a week or so ago and said, Bob, I just don't buy all this talk about how serious this fourth wave is, because I don't hear any about increased deaths. Well, I'll just tell you, we're seeing a very significant increase in the number of COVID deaths. We've gone from 3 to 4 deaths per day due to COVID in the Texas Medical Center institutions to about 40 per day, 40. So we've seen a very significant uptick in the number of deaths per day. Now, I'll say quickly, and I'm sure our panelists will come back to this, the hospitalizations are predominantly unvaccinated people, far and away predominantly unvaccinated people. We're seeing a relative handful of vaccinated people presenting at our hospital. Their average age tends to be quite high, approaching 70 years old for the vaccinated people. But the vast, vast majority, 90% or more of our total hospitalizations in Houston are unvaccinated people. And so when I'm talking about deaths, virtually all, I think Harris Health reported the other day, the Harris Health System, that they had yet to have a vaccinated person die of COVID. That could happen, but so it's very much an unvaccinated phenomena today in terms of those that are presenting at the hospital, staying in the hospital, and ultimately in some cases dying. So let's move on. In light of all this, we thought it was really essential to get the business community responding quickly as best they could and taking actions that were appropriate for the business community. So we're asking every segment of our community to do what we can to stamp out this fourth wave, turn this around, and relieve the pressure. So we issued a note a couple of weeks ago now outlining several thoughts. Oh, I'm sorry, I did skip this slide that's up on the screen now. Let me just hit it real quick, and I apologize for that, Carrie. This is a very recent slide showing the age of people being admitted to the hospital with COVID. This is for a region of the country that includes Texas. And what it shows is the percentage of the population by age group that are now being admitted to our hospitals. And what you see is the increase is all occurring in the younger age group as a percentage of the population for that age group, and a substantial decrease in the older ages. Why is that? Well, the older ages are largely vaccinated to a very high degree, while the younger ages are not vaccinated. So you're seeing a tremendous uptick, 82% increase in the percentage of the 30-39 age group that are presenting at our hospitals. Is just a dramatic case in point. So let's go on, if we could, to the next slide. And I'll skip this one and this one and go right to this. So we issued an email 2 weeks ago asking the business community to do what it could. And we really said to please consider 4 things. 1, be a forceful champion for the vaccination. Vaccinations are the long-term key to avoid more surges like this hitting Houston and to manage through this current wave. As business leaders, it's important that we do all we can to encourage and incentivize our staff to be vaccinated. And we'll talk some more about that. And not just them as employees, but their families as well. We also said, begin giving consideration, if you haven't already, to requiring vaccination of your staff, with the appropriate religious and medical exceptions. And we know that many of you were waiting for the FDA to move from an emergency use authorization to a full authorization. Well, of course, the FDA did that on Monday for the Pfizer mRNA vaccine. So we now have a permanent authorization there. Several of our medical institutions, specifically Houston Methodist, Memorial Hermann, Baylor College of Medicine, and most recently St. Luke's, have now announced vaccination requirements for their staffs. On August 6th, United Airlines became the first major airline to require all of its employees to be vaccinated. And we'll hear in a few minutes from Rick Campo, one of our panelists, about their requirement at Camden to require vaccines. You've also read that Chevron and Hess have required vaccines now for some of their employees, and you're likely to hear more about such in the coming days. We also said our third item is require masks again for indoor workspaces. As you all recall, in the summer, the CDC had come out with guidance saying that vaccinated individuals generally did not need to wear masks in indoor settings. The CDC has reversed that in light of the transmissibility of the Delta variant, and we now know, as a matter of fact, that vaccinated people can become infected and can transmit the virus. And so we've suggested that we go back to wearing masks in indoor workspaces, and consistent with the new CDC guidance. And finally, we suggested to businesses that they reconsider any steps that they had planned to take in the coming weeks and months, at least in the coming weeks, let's say. Particularly, a lot of companies were thinking about bringing more people back to the office or bringing them back to the office more days per week on or after Labor Day. And we've suggested that in light of this way, we defer that. So that's a bit of introduction. Let me now introduce our first panelist, and that being Dr. Eric Boerwinkle. Dr. Boerwinkle is the Dean of the UT Health Science Center's School of Public Health, which is located here in Houston, but actually operates across the entire state of Texas. Eric is a professor in the Department of Epidemiology, and he's the Associate Director of the Houston Genome Sequencing Center at Baylor. He earned his PhD in human genetics from the University of Michigan, and he's been an active participant in many of these calls that we've had with various communities over the last 18 months. Thank you, Eric, for your time. Let me, if I could, just turn it over to you for your presentation, and then maybe you and I will chat for just a second before we go to the next presenter.
That sounds great, Bob. Thank you very much for having me. It's an honor to be talking to this group, for me in particular, because I've tried to beat the drum that good public health and a strong economy are not mutually exclusive. In fact, they're quite complementary. So for having an individuals involved in public health and public health education to be talking to the business communities is a special opportunity for me. Before I show my slides, I do want to give a shout out to the Cullen Foundations, the Elkins Foundation, and the McGovern Foundation, who very early in this pandemic really, wanted to support the kind of work we're doing, thought it would be helpful to the community, and stepped up. So I very much appreciate them doing so. So I'm going to share my screen and go to the first slide. This is the kind of analysis we've been doing for Harris County, the city of Houston, and Fort Bend County, actually, since the early days of the pandemic. And best way to think about this is analyzing sort of the acceleration and speed, and also the momentum, which I'm not showing you, of how fast your car is going down maybe the South Loop. And so you can see that on the left-hand side, this is really the growth rate of the pandemic analyzed. This particular data is from the Texas Medical Center that I selected today. And you can see that little tiny bump all the way to the left is our first wave. The second wave was back in June, July of last year, then over the holidays. And now on the right-hand side, you see the fourth wave. I'd say most important for this group is the acceleration graph, the small one to the right. Notice how the acceleration of our COVID car is declining. So that's good news that the rate of growth of this fourth wave is beginning to level off. I'm relatively optimistic, with the one exception is we have a giant wild card with schools reopening and the mask debates within schools. I'm going to stay out of the political foray in that, but I could just say that the best thing, particularly for those under the age of 12, can do to prevent COVID, whether they're in school or with their friends playing, is please wear a mask. This is a slide because I thought a lot of people would have questions. I was asked to talk a lot and show data about vaccines, and I think it's important that we start with just the left-hand panel of what are these RNA vaccines and how do they work? And I promise there will not be a test at the end. You remember when you were in high school that there was this mantra that DNA made RNA that made protein. So that's, how your body, for example, has muscles in your arm. You've got genes that make the proteins, and they make RNA, and they make the proteins that lay down muscle. And likewise, then we can basically capture the part of the DNA that makes, or RNA that makes the spike protein of this particular virus, take that RNA and inject it into your arm, and your own body, and this is really cool, by the way, your own cells in your body make the spike protein. Your body then recognizes it as foreign, doesn't like foreign substances, and it begins to make antibodies to remove that foreign substance from your body. And that's the way a vaccine normally works, is through these kinds of antibodies and also cells. I'm not going to go through cellular immunity that's on the right-hand side, but we are going to talk later about antibodies in our community and seroprevalence. But this is the way these vaccines work. They have not been rushed to the market. Companies such as Moderna and BioNTech in Germany have been working on this technology for many, many years. And you'll notice in all of this, there's no way that this RNA integrates into your genome. It doesn't influence your fertility. I can't use it to track you on my cell phone. And also the risks of the complications of this vaccine are very, very low. They get a lot of attention in the press, but they're very, very low relative to those same risks of having COVID itself. Trust me, you don't want to have COVID. I'm going to show you, this is a slide that basically has a number of ways of thinking about the impact of having COVID on those that are vaccinated versus not. Bob mentioned briefly, so I'll only cover the right-hand side of this. These are data from a local hospital. The top panel of those blue bars shows discharges. And the reason we focus on discharges, by the way, it allows us to really have good data about their vaccination status, which is hard to do when they show up at the emergency room. But notice when you look at hospitalizations, then the vast majority, 1,245 over 1,313, are in unvaccinated individuals. And Bob actually touched on death. Death is shown on the lower right. If you look at COVID-related deaths in Harris Health this year, so notice it starts in 2021, and this was data up until August the 17th. Unfortunately, we had 137 deaths, but notice 132 of the 137 are in unvaccinated individuals. So far in the Harris Health system, and it won't surprise you, this is an at-risk patient population, primarily because of comorbidities, but notice there have been no deaths in those that have been fully vaccinated. A lot of interest in children. I love children, and I think right now, and probably it's one thing I would add to advice to the business community, and as a person who runs a very large school myself, is this is a good time to be a little bit more understanding of parents that have young children in schools. Kind of cut them a break if you can. Productivity is fine, but right now it's important that we understand what they're going through in the schools. But look at the left-hand side of this. It's basically the number of cases. This is in Harris County, including the city of Houston. And the green line on the bottom is the number of cases between the age of 12 to 19 years old. There are people that are vaccinated. So remember, these are vaccine eligible. And the left-hand slide of this graph starts when the FDA had an EUA for the younger population. The orange, you'll notice, is those that are unvaccinated. So right now, most of unfortunately, the cases of COVID in young people are in unvaccinated individuals. Another reason to get vaccinated. I do want to give a shout out both to, our local health departments, the Texas Medical Center institutions such as HEB and CVS, Walgreens, et cetera, of getting jabs into arms and helping communicate that message. We're, a little bit more than half of our population now is vaccinated, but this slide reminds us that it's not uniform across the county. What's shown in blue are neighborhoods where the vaccine rate's very high. In fact, it approaches near 100%. And that's really that, this won't surprise you, sort of south of I-10, west of the medical center, you've got sort of Westview, Bel Air, you go into Memorial, and then out west, you'll see those regions have higher vaccine rates. But notice the area north and northeast in particular of Houston, the vaccine rates are quite low. In fact, they're less than 30% often. And so as we think about COVID in our community, it's really not a homogeneous mixture. We really need to look at one neighborhood at a time. And it's right now, in terms of getting unvaccinated people vaccinated, often the discussions are one individual at a time. There's been a tremendous amount of information and press about so-called breakthrough cases, those people that have been vaccinated but still test positive. Unfortunately, that whether it's sports people or whether it's our elected officials or movie stars, what have you. And so it's good. This is not really the way to think about how common really is this and is how big of a deal is breakthrough infections. And this is not an easy analysis to do. And what this shows is basically on the y-axis, and I'll slow down because you have to wrap your head around this a bit. If let's look at all the cases and what is the percentage of those new cases that are breakthrough, and then look over time. And you can see that basically starting around March of 2021, we started to see an increase in breakthrough infections. And starting in May and into June, it even accelerated even more. You'll see it peaks, this slide ends in August, and it's peaked around 15% of all the cases are breakthroughs. So you need to look at the flip side of this, and it should not surprise you really. When the Moderna and the Pfizer vaccines were first approved, they had efficacies north of 90%, in fact, some around 95%. When we tested them on the Delta variant itself, it was more around 85%. And so these breakthrough infections are really a combination of two things are happening. Number one, it's the Delta variant. And number two is we're starting to see the first signs of our antibody levels starting to decrease in those of us who've been infected. And again, that shouldn't surprise you. For those of us who have flu vaccines every year, this kind of immunity does not last forever. And that's why you're seeing a lot of discussion about the need for a booster. This slide is the same kind of data, and it compares unvaccinated people in the dotted line and vaccinated people in the solid line. And it's the probability of being positive given your vaccination status. And you can see that this fourth peak is largely driven by unvaccinated people with a small contribution for those of us that are breakthrough cases. And this is some fun data to think about. We run a very large seroprevalence study across the state of Texas called Texas Cares. And so you can actually enroll today in Texas Cares if you want to know your antibody status. And each one of these black dots is an individual. The y-axis here is their antibody status from naturally occurring infection. So these are people who've had COVID on this slide. You can see the red dots, unfortunately, is some people are exposed to the virus and don't make any antibodies. And an active area of work is to try to understand why that is. Now we know of obvious reasons such as a transplant, active cancers, that people are taking medicines to suppress their immune system. But there's other people that we really don't understand why. But you can also see and the reason I put this in is the blue line. The blue line really shows the peak. So about 100 days after you've had your full set of vaccines, if you've got Moderna or Pfizer, your antibodies peak. But then after that, they start to sort of steadily decline. And these data go out basically to more than a year, about 400 days. And this is the last slide. And I put it in particular because what I'm hearing more and more, and you as large employers are probably hearing the same thing, hey, Mr. Smith, I really don't need to get vaccinated because I've already had COVID. I know my body's already making antibodies. So this is what's called a bar or a box plot. The box is basically the high and kind of lows, so the 25th percentile and the 75th percentile. That thick line is the mean. And the y-axis here is the antibodies now from the vaccine. It's of the spike protein. And what that last bar shows you are people that have had infection. So they've been exposed to the virus, but they've not been vaccinated. You can see they're not making as many antibodies as those people that had the vaccine. So, having the vaccine is a much stronger protection than being exposed to the virus. If you want a fun cocktail fact for this weekend, actually the highest immunity you can possibly get are those individuals who have already been infected with the virus and they get the vaccine. Their antibody levels are actually through the roof. So they have that double protection. So Bob, I'm going to end there, and I'm happy to take questions or, when the other speakers are giving their presentations, I'll look at the chat box myself a bit.
Eric, let me ask you one broad question. And what are the risks associated with being vaccinated? That's pretty broad, but what are the risks?
Well, the most common well, first of all, you're going to most of us feel pretty crummy for about a day after. That really is the most common quote unquote side effects. And so again, as an employer, one needs to account for basically that your employees not showing up for work, particularly after the second shot. My wife, for example, slept a solid 36 hours after her second jab. And so that's the most common. And I think we can expect that, by the way, as we see our booster or third shot. And so what that means, particularly in a medium-sized shop, is the need to coordinate things, make sure all your employees don't get vaccinated at the same time. The most common serious side effect is this, this word myocarditis. It's basically an inflammation and an enlargement of the heart that occurs primarily in boys and men, by the way. But it's important to keep it in perspective. COVID itself actually is very hard on the heart. There are cardiac complications. And when you look at the frequency of cardiac complications from COVID versus the frequency of that rare myocarditis from getting the vaccine, the frequency of cardiac complications from getting COVID are more severe and longer lasting and more frequent than the rare side effects. So you should not postpone getting the vaccine because of myocarditis, definitely.
And for women of childbearing age or women who might be or anticipate being pregnant, any issues?
No, good question. And it's a little bit of an emotional question for me, having had to interact yesterday with a pregnant person who died. And so no issues. No, it is important for women who are pregnant or thinking about being pregnant, go ahead and get vaccinated. There's no data to support complications. And I don't understand why, but there does seem to be an uptick in cases, serious cases and hospitalizations in pregnant women right now. And I don't really know the reason why.
And I assume by that you mean unvaccinated pregnant women.
That is correct. Unvaccinated pregnant women.
All right. Well, Eric, thank you so much. And I know you're staying on, so there'll be another opportunity for Q&A in just a little bit. Let's move on to the legal issues associated with the vaccination, frankly, vaccine requirements. So I'd like to introduce Alex Bluebond. He's from the law firm of Vincent Elkins. He's a senior associate in V&E's Labor and Employment Group. He's got significant experience in helping clients solve novel problems that arise in a changing legal landscape, and has become quite the expert, frankly, on the topic of COVID-19 protocols in the workplace. So Alex, thank you very much for being here. Please share your perspective And specifically, if you would, what impact does the full authorization of the Pfizer vaccine have on the legal implications for companies? But you may not want to start there, but I hope you get there. Thanks, Alex.
Sure. Thank you for having me. I'm glad to be here. So I think that the most basic question that some people might still have, but I think most people know the answer to now is, can you have vaccine mandates? And the answer broadly is yes. It's been challenged in courts and those challenges have been rejected. I think one of the most high profile involved Houston Methodist here around the country. We've also seen them with non-medical private employers as well as some universities. And so thus far, all of the challenges to vaccine mandates have been rejected. The EEOC has also said that you can require vaccines, and OSHA is encouraging it. So I think that if it's something you're thinking about, for the most part, you don't have to worry about it. I say for the most part because I'm a lawyer and I do have to hedge. Montana specifically has said that employers cannot require vaccine mandates, or cannot have vaccine mandates. So if you have a workforce in Montana, then you should not do that there. Otherwise, if a private employer is free to do that if that's something they want to do. We've seen a wide array of approaches ranging from the full mandate, you cannot work here if you do not get a vaccine, of course, with the exceptions that I'll talk about for medical and religious exemptions, to carrots and sticks. Some carrots have been the providing $100 if you go and get the vaccine. Could be a discount on some other aspect of a work-related cost. I think one of the more interesting ones that we saw just yesterday was Delta Airlines announced their policy of having a $200 per month surcharge for the employees who are not vaccinated. So that's a pretty big stick that they are trying out that doesn't go the full way of you will lose your job. It's not totally required, but $200 a month is a lot for many employees. And so that would make them potentially change their mind about whether or not they're going to get vaccinated. We've seen employers give all kinds of reasons for wanting to do this. It's ranged from some of their workforce does not want to work around unvaccinated employees. So there's the concern that some vaccinated employees won't want to come into work. We've also seen people concerned about customers who don't want to interact with an unvaccinated workforce, or at least they're very concerned about that. And then we've seen statements about general social responsibility that people have as to why they're doing it. There's all kinds of reasons. One of the ones I'm going to talk about today is that there are some legal and risk management reasons to do it, specifically related to OSHA. OSHA has not set out clear guidelines for all employers like they have in the healthcare industry with their ETS for the healthcare industry, but they have set sort of some advice, is what they're calling it, about how to comply with general OSHA standards, because there's always a general duty of care in OSHA to have a safe and healthful workplace. And so they've given some suggestions about how they can do that, specifically for your unvaccinated workforce. But what they've said is that if you have a 100% vaccinated workforce, you may not have to do all of those requirements, which can be more difficult to comply with, like maintaining social distancing, masking, the sorts of things that can somewhat hinder your productivity at work. If they've said that if you're fully vaccinated, you might not have to do all of that. And I think that we'll have to keep an eye on that with Delta and its impact on vaccinated workforces, because I don't know that guidance is necessarily reflective of Delta's impact on vaccinated people and whether you might still want to mask there. I think that's something to keep an eye on and see what the CDC says. But anyway, I think that one of the things that you wanted me to talk about is how to handle those vaccine mandates if you choose to do them. And one of the questions that I think a lot of people have is, what about these exemptions? How do you handle these exemptions? So if someone comes to you with a question about, or if someone says, I can't do this because of XYZ medical condition, or I can't do this because of my religion, it really isn't that different of a question than if you had people requesting accommodations for different workplace policies. It falls under those same Americans with Disabilities Acts and Title VII sort of requirements. And so the first step you're going to have to do is engage in the interactive process, which means talking to that person about their specific circumstances. Because maybe what that person says is that, oh, they just don't like the vaccine. Well, that's not a medical or religious exemption. They might have claimed a medical condition, but they might not actually have one. So you can ask that question at that point. I know we're trained to not ask about medical conditions and religious and someone's religious beliefs, but if they're requesting an exemption to a workplace policy, you can inquire at that point. And so for the medical exemptions, one of the things you're going to want to do is ask them to provide a note from their healthcare provider. Their healthcare provider will, if they do have a medical exemption, will be able to provide a note that says what specifically they cannot do and why they can't get the vaccine. It's a little bit trickier for the religious exemptions because for the most part, if someone says they have a sincerely held religious belief, and I think that that's an important thing to note, is that their religious belief must be sincerely held, that in general, if you don't have a reason to be skeptical of that, you're generally going to want to accept that and take that at face value. If you have a reason to be skeptical of their sincerely held religious belief, perhaps they've told you different things in the past, then you can require that. Then you can inquire further to get more information. You can ask them specifically what those religious beliefs are that require them to not do this. You can even ask for a letter from from someone at their church or synagogue or whatever religious official that they might be able to get that from, to verify that what they're doing is truly a sincerely held belief. And so I think that the other thing you're going to want to know about this, in addition to asking those initial questions, is also what you do even if they get an exemption. Because just because they didn't get an exemption does not mean that, oh, there's nothing for them. They come around without a mask. They can do whatever they want. It's just like any other request for an accommodation. The accommodation has to be reasonable. And so you can still require them to wear a mask when vaccinated employees are not. You can require them to maybe not attend meetings in person, even though vaccinated employees can. They don't necessarily have to have all the same rules that vaccinated employees have if you need to do that to make your workplace safe. But that's a conversation you need to have with the employee and to consider your specific workplace circumstances, because it's going to be very different for people who work in tight quarters, perhaps are on a rig and live together, or are maybe in West Texas and in the man camps. That might be a different question than whether someone can work remotely, and that's the accommodation you give them. So I think that those are all specific questions you need to consider about that if you're going to have a mandatory vaccine policy. You really can do it and manage these exemptions. You already have to manage these sorts of medical and religious exemptions for all kinds of things in the workplace. I don't think that should stop you.
Alex, one example I've heard is if someone requests an exemption from the vaccine requirement is that they be required to be tested frequently. I assume that would fall under that heading of a reasonable requirement or a reasonable accommodation.
Yes, I think that definitely could be one of the ways you manage that. Again, I don't want to, speak to give that as a blanket statement for every workplace, but that certainly sounds like in many situations it would be a good way to handle that.
And one last very broad question, if I don't throw you a curveball. I mean, what liability should businesses be thinking about, whether they do or don't require the vaccine? What exposure do they have if they don't? What exposure do they have if they do?
Certainly. So I think one of the things that has been interesting to come out of this is the way OSHA is handling reportable cases. So if you have if there's a workplace related COVID case that is somewhat traceable to someone having gotten it at work, you have to report that case on your OSHA 300 form. But OSHA has said that they aren't going to require anything if someone has side effects or complications from the vaccine. So they've created at least an exemption through May 2022 for having to report anything related to that. So I think that for the most part, there's the OSHA general duty standard is leaning in favor of having the vaccine mandates as a way to have a safe workplace, as opposed to managing it in other ways, but there are certainly other ways to manage it through the masking, through social distancing, through work from home policies that employees are taking advantage of.
Yeah, it almost sounds like you're saying that's also a reason to consider your office protocols generally, right? Because that's part of your defense as well.
Absolutely. So yes. So this has also come up in the negligence cases that people have brought that aren't necessarily related to the OSHA duty standard. You want to be able to show that you have a comprehensive plan about how to keep your workforce safe. And I think that you want to consider all of the ways in which you're doing it: mask, social distancing, work from home. But I do think that the vaccine mandates, at least the way things are going right now, seem to help that very strongly for how you generally are providing a safe workplace.
Great. Well, thank you, Alex. And I know you'll be around till the end for the final Q&A. Thank you very much.
Yep.
I'd like to turn now to Rick Campo. Rick leads Camden Property Trust, one of the country's foremost developers and operators of multifamily properties. They've got a market cap of over 14 billion. He's got 1,700 employees around the country. He serves on the partnerships board. He's also the chair of the Port Commission. Thank you again, Rick, for that. And he was chairman of the Super Bowl host committee. And I'll keep saying that, Rick, as long as I know you, back in 2017. So Rick, I want you to talk about, if you would, your thought process leading to a vaccine requirement, what occurred before, and frankly, what's occurred since. So thank you for joining us.
Sure. Thanks, Bob. So when we were, you can hear me okay? Good. Okay, good. Yeah. So when we, let me give you just a little background. So you mentioned that we have 1,700 employees, which we do. 400 of those employees are administrative employees, and most of them are in Houston in our corporate office. And 1,300 of those employees, though, however, are in the field. They manage an apartment property in 170 different locations in 15 cities, 9 states, and the District of Columbia. So we have all these different far-flung places that we're having to deal with. And those 1,300 people have been coming to work every single day, because you can imagine that during the lockdown, people stayed home, right? And they stayed in their apartments as opposed to going to their offices and to workplaces. So we had to change our protocols and to adapt to the system, to the new, sort of new COVID world, and continue to operate our properties and continue to deal with customers every single day. And so, number one, the number one thing we thought about with this mandate is just creating a safe workplace. I mean, bottom line, you have to create a safe workplace for your company. We spent a great deal of time during the whole COVID, experience over the last year and a half of trying to promote the vaccines, how to deal with all the different issues that we're having. We did social media, company videos. When we could meet in person, we would meet in person and talk to people about getting vaccinated and being safe and all that. And we even started thinking about up until sort of late July, we started talking about doing a $125 program where all employees who got vaccinated got the $125 to give people an incentive. At the end of July, though, we had this big spike. We went from flatlining to really no cases in our systems. We had multiple cases plus multiple people die in Camden, and at the end of July, all of a sudden we were on this call with all of our senior people nationwide, and people started getting really nervous because we had this spike. We had a number of cases in properties across the country, and it wasn't just one place. And it really freaked us out. We were like, oh my God, here we go again. And so we decided then to be more aggressive. And then actually, Bob, you helped push us over the edge with your email that came out, sort of supporting mandates. We went ahead and decided to do that on August 17th. We notified all of our Camden employees that COVID vaccine requirement was a requirement of their employment. We first built, before we did that mandate, though, we did build consensus with our management team, because I think it was really important to get our management team all on board. And so we had a number of meetings that we went through to get to that point. And then on August 17th, like I said, we sent this memo out that mandates vaccines by October 25th with all of the various times that people need to do this. We definitely have medical and religious exemptions, and we've had some interesting discussions about those. And as was discussed here in a minute or earlier, one of the things we also did that we just did this week was we didn't want to just have the stick, right? Which is you have to be an employee, you have to be mandated, you have to get vaccinated, or you can't work at Camden, even though that's the bottom line, right? So we came up with this pretty innovative incentive program. So this year, the Department of Business is actually, like all real estate, is really, really good. And so we're outperforming our budgets, and we usually have an outperformance bonus that we give in the subsequent year. So that usually comes out in January of 2022. We know right now that number is going to be somewhere around $5 million, and we generally split it between all employees. So that's $3,000 per employee. So we decided to speed that up. And so we announced on Monday that we're paying $1,500 per employee, basically half of their outperformance bonus. We're going to pay it on October 29th. Now you see the date, October 29th, you have to be vaccinated by October 25th, or you're not an employee. So now people have a $1,500 incentive on October 29th. In addition, we talked about how you'll get another $1,500 once we have all of our numbers in at the end of the year. So if you are making a willy-nilly decision about not wanting to get vaccinated, it's going to cost you $3,000 at Camden if you don't. And so with that said, it's been an interesting process. We have weekly meetings now to talk about how people are doing, and we keep track of all the people who said they will get vaccinated, and people who say they're either anti-vaxxers and they're thinking about it, or people who are just thinking about it. And right now, we only have less than 5% that are anti-vaxxers system-wide. And it is interesting because regionally, it's very different. And so you can imagine that certain regions of the country are very different than Houston. Actually, Houston, I think in our market here with all of our corporate employees, we only have 3 or 4 that are really sort of aggressively against it. And now they are considering, getting vaccinated. So bottom line, it was all about creating a safe workplace. And we have people who are worried about coming to work because of the spike. And so there are a fair amount of people who really wanted us to do this because they want to sort of push those folks who aren't getting vaccinated to get vaccinated. So that's kind of where we are at this point. We are requiring on site that all of our employees wear masks at this point until we get to the point where we know everybody's vaccinated.
Yeah. What percentage, you may have said, I didn't catch it if you did, what percentage of your workforce was not vaccinated as of the date of your announcement a couple of weeks ago?
That was a hard number to come up with, but we know that we thought it was in the 70% range-ish.
That were vaccinated?
But now we know that we've had specific conversations with every single employee, and we know today that we have 86% of our people have said they're going to get vaccinated, or they are vaccinated, and then we have 14% that are considering it and thinking about it, and they'll let us know. And of that 14%, only about 5% could be categorized in the kind of anti-vaxxer candidate or category. The balance of those folks are just thinking about it. They didn't tell us yes or no. They just said, I'm thinking about it.
So there was a risk, and I guess there still is a risk for you that you might lose a number of employees such that it would be hard to operate. And I hear that from a lot of employers who start by saying, Bob, 30 or 40% of my workforce is not vaccinated. If I mandate a vaccine, if I require a vaccine, I can't operate without that 30 to 40%. Now, what you're also saying, though, is a lot of that group is movable. They'll actually move, quickly towards being vaccinated. They won't all end up in the anti-camp. But how did you deal with the risk, if you would, to Camden of losing a lot of employees in a short period of time?
Yeah, I think that you're exactly right, that if you think all the total percentage of the people who aren't vaccinated are going to leave, I think that people just need a push. They need an incentive, or they need something to get them over the hump. And but I will tell you, we are in some of the areas, we have a lot higher population of people who aren't vaccinated who say they may not get vaccinated. And we have contingency plans right now that have been set up so that if we lose those employees, we'll be able to operate without them. And at the end of the day, we usually have 50 to 100 open positions at Camden anyway. And so we have planned on we took the risk that this would happen, but what I really thought was that people would sort of move to the edge and go ahead and get vaccinated. They just needed that little push or that incentive to get it done. And so I don't think we're going to have a massive amount of walkouts or anything like that. And I do think that actually, if you think about it from the other perspective, we will now be able to tell prospective employees that we have, in fact, a vaccinated workforce, and that may actually improve our ability to hire people. And we really think that could be the case, as a matter of fact, because I'll give you an example. Like when we, last year in 2020, Camden was named the #1 large company to work for in Houston, best companies in Houston to work for. And the spike in resumes went up big time because of that. And so I think it's actually could help us replace people if in fact they decide they don't want to be vaccinated or work at Camden.
So, Rick, do you feel better or worse about your decision 2 weeks after having made it?
I feel better. I was definitely more nervous early than I am now, but the feedback has been by and large good. And mostly one of the things that I heard on a big call, we had a national call a couple of days ago, was that people understand. They're not happy about a mandate, but they understand. And at the end of the day, if people have medical issues or religious objections, fine. We have another protocol for them where they have to get tested weekly and wear masks and all that. But generally, I feel much better about it today. And by the way, we in our industry, in the apartment industry, we've had a number of conversations with all the major players in apartments, and I think that a lot of our big competitors are going to get on the bandwagon and require mandates as well.
Well, thank you very much, Rick. If you can stay on a few minutes, let's open the floor for questions. Ben Melson, who's our VP of Strategy at the partnership, is going to moderate. Ben, can I throw the floor open to you?
Absolutely, Bob. We've got, first of all, thank you to our panelists today for answering questions actively. We've answered a lot of the questions already. I do have a few for Eric to start off with. The first, we've got several questions on the issue of masking in the office. And one great one, Alyssa says that her organization is trying to encourage folks to get vaccinated. They're requiring employees to wear masks when they come into the office. What are your thoughts on allowing vaccinated folks to remove masks when they can safely distance in the office? And then another sort of side question to this, how much do masks actually protect the individual versus others in the office?
There's a lot there, Ben. So first of all, the question about wearing a mask in the office, I think it is important that, if there is no way to know who's vaccinated or who's not vaccinated, it is good to wear masks. For those of you lucky enough to have an isolated your own office, it's not important to wear a mask in your office, but most people are in some kind of cubicles or open space, and it's a mixed group of vaccinated and unvaccinated. It's important to wear a mask. If you can be in a one-on-one meeting, which I am often, and we know the other person, I simply ask them, are you vaccinated? Then I'm encouraged to take the mask off to just allow for better communication. And then if you're vaccinated and the person you're meeting with is not vaccinated, I wear a mask, and you're absolutely right. What's happening there is I'm typically protecting the other person more than myself. So it is known that even a vaccinated person may have virus, particularly in their upper respiratory system. And so if while I'm talking, I'm spewing virus, that person who's not vaccinated is definitely at risk.
Thanks, Eric.
I think I remembered all of them.
You nailed it. Sorry to throw so much at you there. A legal question here for Alex. And Alex, I apologize if you've answered this already, but under the governor's latest vaccine mandate orders, first, are private businesses able to require proof of vaccination? And if so, what are your thoughts of disclosure of employee vaccination status beyond HR?
So under the governor's orders, yes, private employers can require vaccination for their workforce. His order does not apply to private employers and their workforce. It does affect private employers who receive state funding, but then it's only about the customers of the work of that entity, not the workforce. And you should not disclose the vaccination status of any employee widely. It should be treated as confidential medical information. So it should be kept separately than their regular personnel file. And it should be on a need to know basis. It should be for HR. It should be for supervisors who might have to enforce other rules, like whether that person needs to continue to wear a mask when a vaccinated person does not. So you shouldn't broadcast someone's vaccination status around the company.
It's sort of related to this, this idea. Can you deny a request for an accommodation to an individual who's in a critical position that you may not be able to replace? They have that particular skill set. And if so, how should our business folks go about that process?
So whether you can deny sorry, I'm getting some feedback. Whether you can deny the accommodation depends on a lot of circumstances. And I have not seen a situation in which it's the fear of this critical person getting sick, qualifying you for an undue hardship. So when a requested accommodation, even if it's a reasonable request, would create an undue hardship for the business, they still don't have to do it. What creates an undue hardship is a case-by-case scenario, but I've never seen just the fear that someone critical could get sick qualify for an undue hardship. It is more related to their duties and maybe the expense of what the accommodation would be. So if this person is in a situation where they have to work around in close proximity with other people, that's a different scenario than just a general fear that someone could get sick, because frankly, there's always the fear that a critical employee could get sick, not just because of COVID.
Hey, Alex, let me flip that question a little bit. Let's say Susie is a critical employee. She makes it clear that she's not going to be vaccinated. She doesn't really qualify for a medical or religious exemption. You'd kind of like to on the side say, all right, Susie, well, this policy doesn't apply to you. It only applies to everybody else. That strikes me as a perhaps questionable decision from a legal standpoint.
Yeah, it's always dangerous to create exceptions to your policies because there's the fear that it's going to be, even if you're doing it for what seems like a non-discriminatory reason, it can always lead to someone thinking it is something that it would be illegal discrimination. So I usually recommend not having those exceptions unless they're based on something like a medical or religious exemption. But like, frankly, like if you could somehow show that it was not that this is not based on, like, I guess I'll give an example. You do that for Susie, and then someone else says, oh, you only did it for Susie because she's a white woman. I'm a black man and you made me do it. And that is a potential, you're treating these people differently. And that might be a basis for a claim for this person if they can show that's actually why you did it. And you just generally don't want to have to put yourself in a situation where you're proving your motives for those things.
Thanks, Alex.
Rick, one question for you here. What, if any, policies do you have in place for your residents related to vaccines or masking requirements? Or if not requirements, what are you and your team doing to encourage vaccination and masking on your properties?
Well, we don't have any specific requirement for our customers. And even though we are masking in our offices, we are not requiring customers to mask, even though a lot of them are masking. In terms of, we do have protocols in place when we enter a customer's apartment and we're doing work in that apartment. We request them to leave the room from where our maintenance people are working and that sort of thing to try to create a safe environment for our workforce. We have not had outreach programs to our customers to try to get them to vaccinate, since we really don't have a lot of control over who lives and what they do. So just the protocols of when we enter their office or their homes. I'm sorry.
That makes perfect sense. I thought we would end on this one for Eric. I thought this was an interesting question. I would love to hear your thoughts on from an anonymous attendee here. So they say, how about this? If you're unvaccinated, you don't get treated at the medical center. When you have a workable solution and don't take it, that's marking yourself as not eligible for assistance. Eric? Oh, you're on mute there, Eric.
Could you paraphrase the question for me? Because I'm not sure I understood it. You're unvaccinated.
I'll put it
You're
this way.
unvaccinated and you don't get, if you're unvaccinated, you're not eligible to be treated at the medical center because there was a workable solution.
That's not true.
No, they're saying if that's their thought. You shouldn't be eligible to be treated at the medical center because you did not receive the vaccine.
No, the medical center is 100% committed to giving the best health care to every individual in our region. And I think that statement goes beyond the medical center institutions, that our hospitals and our healthcare professionals strongly believe that. They've taken oaths that promise to deliver that kind of healthcare. And it's also a slippery slope. For example, do we not treat diabetes in those that are obese? Do we not treat car accidents in those that didn't wear a seatbelt? Where, we, particularly as the dean of the School of Public Health, I could talk for days about the importance of prevention and the importance of, not getting COVID, not getting diabetes, not having a heart attack or a stroke, et cetera, not smoking, of preventing these diseases. Nonetheless, we do know people do get sick and we have to treat them, and we try to treat them and give them the best outcomes possible.
There's so much anger in our society these days, Eric, on so many topics. Unfortunately, this is a topic that is producing more anger in some settings, where I think the vaccinated are becoming more upset with the unvaccinated. That probably doesn't serve any real purpose.
That's
encouragement does. Anger probably doesn't.
It doesn't. And again, we need to be professionals to provide the best treatment. It's true. I'm tired. And you get frustrated. But nonetheless, on a day in and day out, the workforce here, they're the best people I know. I'm honored to work, right outside my offices. I'm embedded in the middle of the Texas Medical Center and honored to be there. And we're here to serve the business community and your employers and your customers, to give them the best healthcare possible.
I heard something I thought was really interesting from a good friend of mine whose son wouldn't get and daughter-in-law wouldn't get vaccinated. And their argument was, well, I already had COVID, so I don't need to be vaccinated. And we saw today that that's not true. And so what he did is he said, fine, you can't come to the house. You can't see any of the other grandkids or any of our family members. And you can't go to our lake house or use any of our amenities until you get vaccinated. And so they both ran over to the county place, got $200 and got vaccinated so they could come to dinner.
Yeah, they got $200. Like you said.
Yeah, they got $200 from the county.
That's right. Well, thank you all. Thank you, Rick, Eric. Thank you, Alex. Thank you, all three of our panelists. Really appreciate your time. Thanks all of you who've joined today's call. For the latest data and resources and information on the virus, please be sure and bookmark the partnership's COVID-19 resource page. It's houston.org/coronavirus. And please keep referring to that. We'll keep it up to date and look forward to hearing from you. Let me just end by going back to what we suggested 4 weeks ago. We encourage offices to be masking all their employees at this time unless people are able to maintain social distancing. So as Eric was saying, based on the workflow, you may be able to be unmasked, but otherwise we're encouraging masking. We are encouraging companies to think hard about whether they should be bringing anyone back to the office on or about Labor Day. Let's get through this fourth wave. We encourage you to encourage your employees to be vaccinated. And we ask you to consider whether a vaccine requirement wouldn't be appropriate at this juncture for your business. So thank you for this opportunity to speak to all of you. And I look forward to seeing you again with some better news in the days ahead.
Thanks, Bob.